Hi, I'm Dr. McCartin. I'm a neuro optometrist and owner at the Visual Processing Institute, which has 4 locations, 4 clinics throughout LA and Orange counties. In this video, I'm going to talk about what can happen to your vision when you have a brain injury and truly explain in detail what your visual processing system is, how it develops, how we compensate for an injury and mask symptoms even from ourselves, and how I and hopefully you can identify deficiencies so they can be diagnosed and treated. As a neuro-optometrist, I diagnose and treat visual processing deficiencies through vision therapy and vision rehabilitation. These deficiencies can occur congenitally or they can be caused by an injury. When a visual processing deficiency occurs, it's caused by damage not to the eyes, but instead to the brain. And it damages the portion of the brain that processes all of the data that the eyes deliver and make sense of. So the really severe problem is that in order for your visual processing system to operate most efficiently and at its best, it actually involves nearly every part of the brain and brainstem. And I actually see a lot of patients who have more severe visual and spatial processing symptoms from whiplash without any head impact than I do from some patients with severe head impact and even lacerations. So let's start with what is causing the symptoms and decreased quality of life that patients suffer from. In short, what is damaged and becomes deficient is the visual processing skills. Now, of course, as I say that, I know that it can mean absolutely nothing to you. I will completely admit that that meant essentially nothing to me until I was in my doctorate and I learned more about this sensory system that is arguably more complex than any other sensory system in our body. Your visual processing skills are a collection of roughly 20 individual skills that you have to develop in order to build your virtual reality that you see around you and build it hopefully as accurately and close to reality as possible. If you make a mistake in building that virtual reality, you will inevitably guide your body to the wrong point in space and therefore make a wrong step, walk into something or bump into something, guide the muscles of your eyes and aim them to the wrong location and get double vision. Flex or relax the muscles that wrap around the lens inside of your eyes and focus the lens inside of your eyes at the wrong location and get blurred vision. And that can happen at a distant object or a near object. Or at best, and I guess maybe worst, not even notice your error because you can just barely compensate for it and limp along with migraines, eye strain, light sensitivity, decreased higher cognitive skills because you're exerting so much energy trying to make up for the deficiencies that you have, fatigue earlier in the day, earlier than you should, nausea as you are compensating for the symptom that's supposed to tell you where you are in space, short-term memory problems, and essentially a long list of struggles that include having a hard time with everything you do when your eyes are open. Does that sound brutal? It should, because it is. Visual processing skills are skills that we are not born with. We start working on these skills in infancy. We're not born with a knowledge of what light data actually means. We don't get any exposure in the womb. In the womb, we get exposure to sound, touch, taste, smell, and just about everything, but no spatial data based on light. The moment we are born, we have to start making sense of this. And it is as if you took me, blindfolded me, and shot me up into outer space. I would certainly cry, and I would absolutely panic, not getting any known data about where I am. If you said, oh, well, we'll give you a sense of radar and sonar or some other sense, that would bring me no relief because my brain would have no calculations and processing systems that can translate and process that data. I would have to very slowly learn how to make sense of everything. So in order to better understand what symptoms can occur when these systems don't operate properly, it's really important that we understand how the system even comes to be and develops. So how we obtain these skills in the first place. This is what happens when we're born. We're hit with light and we lose the pressure of the womb telling us where we are in space. We have to now develop a set of skills to make sense of this light data. This process of developing new skills is something we do with everything. We develop the skills of how to move our lips and our tongue and our cheeks just in the right order to make specific sounds and talk. We develop skills of how to coordinate each and every muscle in our back, core, and legs and feet in order to stand and walk. So this concept of development is not foreign and new. It's just unfortunate that there's a common misconception that we are born with the knowledge of how to process this light data, and then also how to coordinate the movements of our eyes in an efficient and productive way to collect more data. In the same way that a blind person would have to master the perfect way to guide their hand across Braille in order to collect that spatial data, we must all learn how to guide our eyes to aim and focus, meaning clarity, which will require different pathways through the brain and brainstem in order to collect spatial data about our world. I often joke with my patients that I am the eye doctor who thinks the eyes are boring. I tell them that the eyes are mindless little balls of jelly, and they are. They have absolutely no anatomical tissue that process and makes sense of the data they collect. They do have some tissue that process light data in a specific and unique way and patterns, but they are not building the 3D world that we must operate. They are just cameras, and the brain has to do all of the work. I state and stand by my frequent statement that vision has so little to do with the eyes that there are people who are completely blind that have better visual processing skills. Again, that is the ability to build a virtual reality that is accurate with our world than some of the patients who walk into my office. To drive home that bold statement, I said that to a patient of mine in her 80s who was struggling to process visual data after getting cataract surgery that went flawlessly. With cataract surgery, the lens inside of your eye is removed and replaced with a synthetic one. The new lens is clear, but it will have slightly different optics. It is a slightly different shape, and even though this patient had 2015 vision, which is better than 2020, and had an absolutely flawless surgery, her brain now needed to learn slightly new equations in order to make sense of light data that was now being presented to it in a slightly different way. A good analogy would be needing physical therapy after a knee replacement. Technically, the new part is better than the old one, but the brain will still need to relearn how to operate with its new equipment. Upon hearing my bold statement, this patient shared with me a recent experience of having difficulty getting onto an escalator, as her visual processing deficiencies now included decreased ability to accurately process depth and keep up with the moving objects. She was a retired speech-language pathologist, and as she struggled while at a large shopping center with a group of people she volunteered with who had various physical and cognitive challenges, her completely optically blind friend came over to her and said, "Here, dear, take my arm," placed his hand on the rail of the escalator and helped her down. Now, how is this possible? As I said, accurate visual processing has nothing to do with your eyes. It is all work done by the brain as it processes sensory data from various systems to build a 3D world so we can avoid predators, find prey, find shelter, find our tribe, and survive. The visual processing system utilizes auditory data, vestibular data, tactile data, proprioceptive data from the stretch receptors in our joints, but mostly visual data, as it tends to be the most detailed and descriptive of our space. When Porsche flew me out to Atlanta to speak to a group of race car drivers, to drive home this point to a bunch of young men and women in their late teens and early 20s, I brought up lunch. I said how I was dying for a double cheeseburger with lettuce, tomato, pickles, bacon, the In-N-Out burger sauce, and a lightly greased bun. I asked them if they could all see it, and they nodded. And then I asked them how much of their eyes were contributing to that picture. And their eyes all got big, because obviously your eyes didn't contribute anything to that picture. That is your visual processing system, and the collection of skills that compile it must be developed from infancy. If the eyes make an incorrect movement, it is not a mistake of the eyes. They are too stupid to even control their movements. It is a brain problem, incorrectly guiding the eyes. The large set of skills that we have to develop to perform at our best and be symptom-free takes 13 years to fully develop. To put into perspective how long that takes, it only takes 2 years to learn how to walk. If someone were to get a brain injury and have difficulty walking afterwards, even my 4-year-old could identify that something is wrong with them neurologically. the anatomy of the rest of their body and their legs are just fine, then it would be undebatable that they should have therapy to relearn and redevelop the neurological skills that they developed in their infancy and the first couple years of life, and that the brain injury damaged those learned skills. To continue to put into perspective how challenging and complex our visual processing system is, walking is so easily, we literally know the codes for it. We type the calculations into a computer, plug that computer into a chunk of metal, and the metal and parts can walk around just as well, if not better, than some humans. But we are nowhere near creating a device with the amount of software, hardware, and processing power required to simply go into a room and build virtual reality within a split second, like my 4-year-old can. And she is still 9 years from fully developing these skills. So now, as I have just scratched the surface on how insanely complex these skills are, let's think about the lack of truly self-driving cars. Hopefully it is easier to wrap our heads around how a deficiency, the visual processing skill, is a big problem and something that absolutely deserves the attention and therapeutic treatment that a deficiency in a walking skill would get. Personally, professionally, and logically, I would say that it should get a lot more attention, because a person could return to work and be at their cognitive peak, sadly, in a wheelchair, but they will never be anywhere near their full potential and full quality of life and being self-sufficient with the deficiency of just one of the 20 known visual processing skills. So what are some examples of visual processing skill deficiencies, and how can they present in a patient or one of your clients? Before you can understand the symptoms, it's important to understand that patients will probably not complain of a direct symptom, and they will compensate so intensely that they will mask the problems even from themselves. The biggest challenge with visual processing skills becoming deficient in adults is that adults are aware of what they should see before they see it. Meaning, if they walk into their house, they already know exactly what their furniture looks like, how many steps it is to each item, and countless other details about their workspace, living space, local grocery store, streets that they drive down, and so forth. Even if it's a completely new environment, they are cognitively aware that if they were to walk into a building and see double of somebody, they're probably not twins. And the person has cognitive awareness that their eyes are not aimed at the right location, and they correct for it before they can realize and become aware that they are correcting for that misalignment. Now, this is a problem because how we learn anything is with biofeedback. If you were to think that 2 + 2 is 5 and no one ever gave you the feedback that you were wrong, it doesn't matter how intelligent you are, you will think that 2 + 2 is 5 for the rest of your life and continue to make that miscalculation, albeit probably with some frustration. One of the reasons that learning how to walk happens so incredibly quickly compared to developing all of our visual processing skills is because you immediately get feedback of even just the slightest twitch of a muscle guidance mistake, you'll fall. Or at the very least, you'll get biofeedback from your proprioceptive system and stretch receptors in all of your joints telling you that your body is not straight. Vision takes such a long time to learn because you only get biofeedback as to whether or not your eyes are aimed at the right location, or the flexible lens inside of your eyes are focused at the right location. If it is something that you can touch with your hands and confirm tactily that the data you are collecting with your eyes and delivering it to your brain is indeed correct. That means anything beyond your fingertips, you don't get any biofeedback as to whether or not you're guiding your eyes to the right location until you are old enough to be cognitively aware of what you should see before or just as you see it. I often joke with my patients that if a baby were to walk into the room with their eyes crossed and have double vision of everything, they're not cognitively developed enough to know that there are not 2 doors, 2 windows, 2 chairs, 2 identical sets of every person. So circling back to how brain injuries and a loss of these skills in adults is so problematic, if an adult were to walk into a room and have double vision of everything for even a split second because they have, say, divergence insufficiency, something I see in nearly every post-concussion, whiplash, or brain injury patient, they would immediately receive cognitive awareness that their eyes are not postured in the right position and correct for the misalignment and end up never being fully aware of the actual problem on a higher level to where the problem has become obvious and acknowledged to require repair. We are cavemen. We have evolved in amazing sensory and cognitive redundancies that allow us to adapt and lean on other symptoms. And this has worked amazingly for us for thousands of years. But our world and our demands are not the same as they were even 100 years ago. The demands on the visual processing system to keep up with where we are in space, just when we're traveling in a car, is something that our body did not have to have the need to perform 100 years ago, and certainly not thousands. And yet, our anatomy is not that much different, or arguably different at all. So now, because our world demands so much more of us, even the most seemingly mundane task, as reading off an email, often artificial light source, and thinking about the person on the other side of the email and everything we've learned up to that point, and solving the question they're asking and forming a good response, actually requires a lot of processing power. Living your life nowadays while compensating for a deficiency and still expecting the same quality of life and the same production value, which could translate to making the same amount of money, having the same high quality of relationships with others, or experiences with work or play or travel or just day-to-day activities, is not realistic or likely in the way that compensating through these deficiencies for the rest of your life would have been thousands of years ago, when the visual demands and tasks were so much lower. We have evolved to not default to exerting the extremely high amount of energy it would require to be aware of these deficiencies on our own, and instead evolved to having a default of compensating and just making it through, because our past environments did not require these skills to be operating as efficiently as our environment does nowadays. On an ethical and evolutionary note, one could argue that it is our ethical and evolutionary duty and advantage to provide resources to rehabilitate these skills to the best of their abilities for everyone in our community so they can perform at their fullest potential. We already do this for every other skill that needs to be rehabilitated. Vision is just something that is misconceived as being something we are born with. So deficiencies are written off as other possibilities and go missed. So circling back again to how patients compensate for deficiencies so quickly and seemingly autonomically that it leaves them being unaware of the deficiency. An analogy that I often use is to think of someone who slouches at their computer and has poor posture. When they walk into the world and see themselves in a mirror or compare themselves to someone else standing straight, they immediately get biofeedback that their posture is incorrect and they correct for it. To everyone else, they look perfectly fine without errors or deficiencies for as long as they can compensate. But they would probably complain of back pain and other aches throughout their body as they now have to constantly compensate for that deficiency in posture. And that's what visual processing deficiencies complain of. Because they are unaware that they should see of what they should see and correct, because they are aware of what they should see and correct for it so quickly, they never have the opportunity to relearn the skill that they have lost. In vision therapy and vision rehabilitation, I completely cheat. I use tools and equipment to create visual and spatial situations that would absolutely never happen in the real world. These artificial visual situations provide the brain with biofeedback when it's making an error in calculation of one of its skills. So it now has the opportunity to relearn it. Considering I and countless neuro and developmental optometrists have patients who have come to us decades after a brain injury, still struggling with these visual processing skills, and these deficiencies have been found to be lifelong conditions if left untreated, there's no evidence that I'm aware of that supports that they will recover or redevelop on their own with any amount of time. I currently have a patient who tried to return to work a year after a brain injury and was throwing up at her desk within the first half of the first day back and working on her computer. So now that we hopefully understand what is actually damaged, the neurological skills in the brain, and how these skills first developed over the course of 13 years of life, and how patients will compensate for the deficiencies before even noticing that something is wrong. In a course at the annual Neuro Optometric Rehabilitative Association's annual conference, they presented data from a study that found that most symptoms are not noticed until several months after the injury, as the brain so quickly compensated in an effort to survive. What are the actual symptoms that you should look for in your clients and ones that they will mention? Well, this is where you need to be a really good detective and obviously send every single brain injury and whiplash patient to have a thorough evaluation with a neuro-optometrist, because even if you ask the perfect questions, and I do in my exams as well, patients will likely not even be aware of their symptoms. When it comes to asking about symptoms, what are the things that your clients do when their eyes are open? I'm sure you could all sit there and read off a bullet point list of symptoms in 30 seconds, but you aren't watching this video to get another piece of surface scratching information. So to understand the symptoms, it'll be much more valuable for me to explain the order of operations and priorities that your brain has. When you wake up in the morning, before you even sit up in bed and turn to the side to stand up, and I have patients who suffer just in that. Their complaint starts when they roll over in bed to stand up. Before you think about work, your family, friends, bills, to-do list, what you're going to have for breakfast, your brain has to use as much energy and processing power as it needs to figure out the answer to its number one priority and question: where am I? I know it seems, well, hopefully it seems simple. Hopefully this is all something that you have had the luxury to never even think about. That means your visual processing skills are working efficiently and effectively, because these are things that should be autonomic and foundational, and you should never even be cognitively aware of them. But just because you aren't cognitively aware of them doesn't mean that they aren't using up energy. You're probably not cognitively aware of your digestive system right now, but it's working and operating all the time, and you will become aware of it if it doesn't work efficiently, right? If your visual processing system doesn't work efficiently, it is priority number one. Your brain will not even be capable of thinking about your emails, family, friends, commute, or even the most remedial task that enters your mind right now if it can't answer the question, where am I? Because if your brain can't answer that, you will fall, or you'll walk into something, or you'll throw up, because you will feel like your world is moving because you can't figure out, where am I? To drive this message home, if you were to wake up and your ceiling was 4 inches from your face, you wouldn't panic because of how close you are to your ceiling. You would panic because your brain would calculate where you are and very quickly realize that you are a long ways away from the floor. If we were to put an admittedly random number on the percentage of energy that your visual processing system should require if it's running efficiently, and say it requires 5% of your energy, and instead, because of your brain injury, your skills have regressed to that of an infant or child, which I can measure and can compare in my evaluation, and have even joked to one tearful post-rear-ended patient in a therapy session that her visual skills are that of a baby, and she learned them once and she can learn them again. And let's say that these skills now require 10, 20, or 30%. Well, then that is 5, 15, or 25% less energy that you have to do everything else you do when your eyes are open. So that is what is affected and will present as symptoms. Difficulty doing everything when your eyes are open. And I am not trying to be facetious in wording it this way. I admittedly am using everything you do when your eyes are open from a mentor of mine who's been practicing for over 40 years. I say that to be inclusive of symptoms. If I were to be specific, direct symptoms of visual processing deficiencies can include, but obviously are not limited to, headaches and migraines, poor balance, dizziness, feeling like the floor is moving even if you are not, feeling like the walls are moving even if you are not. Think of what it would be like to be in a glitchy virtual reality system. Double vision, blurred vision, shadowing vision, fading vision, inconsistent vision, poor depth perception, poor peripheral vision, eye strain, dry eyes, as patients will often decrease their blink rate in attempts to focus and understand what they're trying to see. Rubbing eyes, preference of closing one eye. Any patient who sees better out of one eye than two is probably suffering from occasional double vision. Their brain has learned how to correct for it, right? Decreased reading speed and reading comprehension. Feeling like words or letters move and jump on a page. This normally happens when the brain is struggling to aim both eyes at the correct location in space, so it starts to suppress one and let it drift to the side. When it then fatigues and switches to suppressing the other eye, now the page is viewed from a different angle, and everything in that patient's world just shifted and did indeed move. Other symptoms are brain fog, general fatigue, short-term memory challenges, difficulty solving problems, difficulty conversing with others. That's a very higher cognitive skill. Light sensitivity. Deciding how much light we take in and absorb in this very bright world is also a higher order skill. Your brain does not care about it if it is exerting all of its energy just to make sure it builds one accurate world. Car sickness and motion sickness, even when simply jogging or walking fast. These are all symptoms I have heard straight from my post-injury patients. Cognitive and visual strain in visually busy environments such as restaurants, grocery stores, shopping center, crowds, and so forth. If your client hates going to the grocery store now, they need to see a neuro-optometrist. Such an obvious red flag. Obviously, this is not an all-inclusive list, but it isn't a stretch of the imagination to understand why anyone who's struggling with any number of these symptoms on a daily basis could then suffer from tertiary symptoms, such as anxiety, feelings of hopelessness, like these symptoms will never go away, and as everyone says that they're just fine, just because their brain scan didn't show any damage. Further feelings of hopelessness can certainly lead to depression. And this stress on the fight or flight system has been shown to actually further exacerbate several of these deficiencies and visual processing skills. Now, hopefully this helps explain how the visual processing skills can cause these symptoms. And for the record, seeing 20/20 or good visual acuity is just one of the 20 visual processing skills that we have to develop. I once wrote an article titled, "Why 20/20 is the least useful skill." Now again, this just scratches the surface on the complexities of our visual processing system and the multitude of skills that it consists of. I didn't even mention skills of decoding and identifying objects, even if they're seen from different angles and in different formats. Higher order visual information processing skills are wildly complex, and we are nowhere near being able to replicate these skills in any software program. These are the skills you obtain when our computers know you have them, when you are presented with the "I am not a robot" test. Again, my 4-year-old can pass those, and she still has 9 years of developing this fully developing this complex system. So finally, this video was inspired after I spoke with a personal injury attorney about a patient of his that I am treating. The question was regarding her glasses and why I did not prescribe her any Prism. So a final quick note on treatment with glasses and specifically Prism. I always prescribe glasses to correct for a refractive error. Think of it as wearing a shoe that fits your foot in a customized fashion and allows for an ergonomic fit and alignment with the ground. The shoe does not contribute at all to the neurological processes of guiding all of your muscles in your back, core, and legs to stand or walk. A shoe could help sense the ground in a correct and flat fashion and can certainly have errors and make things worse. And glasses are the same way. They serve one purpose, and that is to correct for the misshape of your eye. They are a hard piece of plastic. They aren't flexible or dynamic. Your brain must do all of the other work. So there is not a pair of glasses on the planet that will treat or correct for a visual processing deficiency, just as there is not a shoe on the planet that will teach you how to walk. Your brain must do the work to develop these skills. As for Prism, Prism moves the picture of where a real item is. So it moves the image to where you are incorrectly posturing your eyes. It is like giving someone who hunches at their computer a cane under their shoulder. Yeah, it feels good now and clearly sells a pair of glasses, but has never been proven to treat a visual processing problem. The patient still has the problem, and even worse, in many cases, it has been shown to further enable and encourage the problem and make it worse. I have patients in their 50s who now have eye turns or lazy eyes after being given prism that increased each year for the last 5 to 7 years, and now they can't get enough in their glasses. A professor at a well-known optometry school said that prism is poison. Me personally, I have only prescribed prism in a very small handful of times in very extreme cases, as I am able to treat and often cure misalignments without ever needing prism. So, again, I hope this helps. It truly just scratches the surface, but I'm obviously passionate and really obsessed with this system that is so often overlooked and completely missed. If you have any questions, please feel free to email me at drmccartin@visualprocessinginstitute.com. And I can also share my personal cell for clinicians and professional colleagues to better reach me if you email me. Thank you for listening and taking time to provide this really detailed information for your patients and increase your knowledge of this system that is often overlooked by clinicians and other professionals. Thank you so much.